Okay, hello everyone. First things first, can you hear me? If you can, pop a message in the chat for me, please. Amazing. We've got confirmation. Fantastic. Brilliant. Well, thanks, guys. We've got 16 participants at the moment. I think just in the interests of time, it's about 6 minutes past now. So your time is precious. I think we will move on. Cool. So welcome, everyone. Welcome to this session on why to study medicine or why study medicine. And this is by SixMed. My name is Joe. I'm a medical student at Barts in the London School of Medicine and Dentistry. So some of you, if you are interested in studying in London, you might have heard Queen Mary. So Barts in the London is part of Queen Mary. But I'm currently residing at the Royal Veterinary College, doing a year of research in their labs. A bit about me. So a disclaimer to begin with, I am one medical student at one medical school. So what I say and my opinions on things are the opinions of only one medical student. A lot of things of what I say will be transferable and will be just generally true. But if you speak to other medical students, your mileage may vary. So my first question to the crowd, really, I'm going to try and keep this as interactive as possible a little bit, is why do you want to study medicine? Because if I get to know why you guys want to study medicine, then I can kind of start to answer some of your questions. So I have here, and hopefully you should be able to see this, a Mentimeter asking you, why do you want to study medicine? So you might have seen Mentimeter before. Essentially a little website. You can go on your phone or you can go on your laptop, what have you. Type in www.menti.com and then you enter the code 6180-3495 and then you can write essentially, why do you want to study medicine? I want to know why you guys want to study medicine. And if you're unable to do that, you're more than welcome to put something into the chat. You can privately message, but anything would be great. It's fun. This is true. We will get to how fun it is and whether it's always fun. It might be another question whether it's always fun. Problem-solving aspect, yes, definitely. It's rewarding, exactly. That's a really big thing. I think if you are someone who enjoys giving back to the community, enjoys interacting with other people, it's so true. I like pain. Interesting that to an extent, academic pain, academic challenges, continuous learning, exactly, fascination, variety. I want to help people is a solid answer there. Fascination. House. Okay, I assume you're referring to House MD. That's wonderful. I wouldn't say that's something to write in your personal statement, but if it's any clarity, I didn't really start considering doing medicine until I started watching House MD. But don't tell anyone that. I'm curious about disease, exactly. So if you're curious about disease, maybe you're curious about pathology. Pathology is the study of disease. And if you're passionate about pathology, exactly, that's so important. Let's see any more. I love bio. Okay, yes, so if you're taking A-level biology or IB biology, I would say biology is probably the most translationable kind of precursor to medicine. A lot of things in bio you're going to be reusing again. Grey's Anatomy. I think we've got a standoff here. Are we 50-50 Grey's Anatomy, 50-50 House MD? Interesting to apply info. Exactly, yeah. So it's What's interesting about medicine is that there's a great deal of research and there's a great deal of understanding the science behind the cure. And then there's actually enacting that. So it's what we call translatable research from, you're going from the workbench to the ward, essentially. House is better. No, definitely Grades. Okay, well, I'm glad we've got a little bit of competition here. I want to help people. Healthcare is changing. Healthcare is definitely changing. And I think you'd definitely discuss that in more detail. You could say, how is healthcare changing? The person who wrote that, maybe tell me how it is changing. The ability to save people. Exactly. I think save people, that's you're kind of referring there maybe to kind of saving a life, saving, a lot of people think about restarting someone's heart, but arguably maybe you are saving them from changing their lifestyle choices, maybe stopping smoking, maybe reducing your alcohol intake, maybe, so it's what you call healthcare promotion, health promotion, promoting a healthier life is a big role of the GP. The Good Doctor, yeah. Okay, so we've got 3 good TV shows here. You forgot Scrubs. Lest I forget Scrubs. Technology advancing, yes, exactly. A fantastic example is in radiology, AI. So artificial intelligence actually identifying fractures within bones. Arguably, AI, if taught correctly, can have greater accuracy than some well-trained radiologists. And so that is changing the face of healthcare. Medicine is a theory. Yeah, so there's a lot of kind of theories. Certainly in medical school, you'll learn a lot of things that help up the kind of building blocks of understanding, okay, well, this is why we use this drug and this is why we take this approach. Maybe it's not always 100% accurate, or maybe it's not got tons and tons of evidence, but it's the best thing we know. Suddenly you realize that a lot of medicine is built on, this is the best we can do at this point. Brill. So I'm really chuffed with this, guys. Well done. Community you work in. Yeah. So it's definitely, I'll probably come on to this a bit more, but about work experience and about giving back to that community. Brilliant. Okay, cool. So we've been over why you want to study medicine. That's fantastic. And so medicine is a exceptionally multifaceted profession. And when we're talking about studying medicine, medicine is a hugely diverse and quite a long course, and it's a really fascinating course that ultimately sets you up. It's a vocational course, ultimately sets you up for a career working as a doctor. Statistically, about 60% will go into GP practice, so you become a GP. 40% will become secondary care clinicians in hospitals. So, for example, here we've got a lot of people may go into GP. They may go into research or pathology. So someone said, I love disease, I find disease interesting. Pathology is the study of disease. Some people may want to become surgeons. Some people may want to become what we call kind of that internal medicine, or that kind of not surgery, but treating with drugs and treating with therapies, etc. And there's rehabilitation doctors. Essentially, it's endless. And what medicine is medicine is a 5 to 6 year course where you learn the basics and you spend a bit of time doing your preclinical, learning the knowledge, a bit like biology. You're learning the basics of the biology. And in medicine, we break it down to anatomy, which is the study of the structure of the body, the nerves, the blood, etc. We look at the physiology, how it works. And then there's multiple different systems that we can look at and break those down. We can look at how humans think, how humans interact socially, societally. So it's really important. And medicine is kind of this course that sets you up for this really exciting journey ahead of you. So what is it like to study medicine? So I'm going to tell you a little bit about what it's like to study medicine before I'm going to tell you what it's like to apply to medicine. Because if I put you off now, you probably won't want to listen to the bit about studying, applying to medicine. So what is it like studying medicine? So I'm a third year medical student at the moment. So I'm kind of in that sweet spot where I'm in the middle of my studies. So I'm fairly, can remember quite well my whole application process, but I'm kind of getting on now and I'm moving into my clinical years. So medicine is a 5 to 6 year course in the UK. Some universities will have a 5-year course. Some universities will have a 6-year course. Yes, there will be a recording. I believe this entire thing is being recorded at the moment. You might be able to get subtitles. So I'm just checking the chat. I believe it is being recorded though. So if you, I will speak to my supervisors at the end of this. But the interest of time, so medicine is, as I said, a 5 to 6 year course. And it's split into, the start is a preclinical. So it's kind of studying the bookwork. It's studying a lot of the kind of principles, the basic science. And then gradually during years 3, 4, and 5, or 4, 5, and 6, if you're a 6-year course, you'll end up spending more time in hospitals, GPs, etc. Is preclinical better with hospital visits? Okay, so you're definitely preempting what I'm about to say here. So what I am going to say is this is what a medical school timetable looks like. Don't be phased, but I really wish I saw this before I applied to medicine. It's just a bit of knowledge, so you don't really see many of these. So this is my medical school's timetable. So just ignore all the abbreviations, because it's really unnecessary. What I'm trying to tell you is that in your first year and your second year, let me see if I can find a pointer. Here we are, there we are. So in your first year here and your second year, you're essentially doing bookwork. You're doing lots of bookwork, you're learning about the basic biology. You do something called fundamentals of medicine, typically at the start of your medical degree. And that kind of really helps people ease into this understanding. You're building on things that you've learned in biology. So in biology, if you learn about respiration, you learn about mitochondria, you learn about the function of mitochondria. In this unit, you're suddenly going to start to learn actually, okay, what in a bit more detail that you need to know. So, okay, so what exactly is the Krebs cycle? What kind of things are coming out of the Krebs cycle? What things are going in the Krebs cycle, et cetera, et cetera. And it sets you up for this kind of this 2-year study where a lot of it is bookwork. So what Sharon's just said here is preclinical better with hospital visits? So what you're talking about is you're talking about an integrated degree course. So there's kind of 3 or 2 main styles of medical degrees. The first medical degree style is your traditional style. So it's total bookwork for the first 2 or 3 years. I mean, you live in the library, you don't see any patients at all, you don't go near a hospital, you don't go near a GP setting. Then your years 3, 4, 5, or 4, 5, 6, if it's a 6-year course, you will be permanently just in GP settings, hospitals, etc. That is a traditional course, and that's typically done at places like Oxford and Cambridge. And I can't really think of any others off the top of my head. But more popular now is something called an integrated course. And what an integrated course is that you very much have your preclinical years, as I discussed, so year 1, year 2. But you'll see here, you have things called like integrated teaching weeks and kind of student selected components, these. And so these are kind of opportunities to go out and spend a bit of time in hospital and see what happens, or spend a bit of time in a GP practice. I remember in my first year, every other week, I would spend 1 day in a GP practice. And in my second week, I would spend 1 day a week in a GP practice. And then the next week, I would do it in a psychiatric unit. So it's kind of blending it. And this is really important to think about when you do eventually apply. But yeah, medicine is really busy, as you can see from here, because by the time you hit year 3, which is your clinical, you're still getting a bit of lectures. You'll see these little blocks here, these called introduction, clinical methodology, little kind of teaching units here, more teaching units. And you get less and less bookwork and more kind of clinical teaching. spending longer on placements. So that's the general gist. And this is really useful. Obviously, this lecture is recorded, so if you do want to go back and actually understand a bit more about this, you can have a look. So what is the hardest part of studying medicine? So I've kind of snuck in here. But what I wanted to ask people now is what they think the hardest part of medicine is. From what I've just said, what I'm going to do is I'm going to, there you are. What do you think is the hardest part of medicine? So going back to our Mentimeter, you can't write Grey's Anatomy. Grey's Anatomy is one of the nicer parts of medicine because it's going home and watching it after a long day. But what do you think is the hardest part of medicine? Great, we're getting some excellent responses here. Getting into medicine. Now that's really interesting that you say that. And you speak to a lot of medics, and they say one of the hardest things is getting into medicine. Once you're in medicine, you are in the course, and most universities will try and keep you in. Well, all universities will try and keep you and try and help you as much as possible to keep going. You always hear these horror stories of, oh, people drop out of medicine or all the university kicks them out. It rarely happens that the university kicks them out. People drop out on their own accord, etc. It's in the university's interest to help you as much as possible as a medical student. So to be honest, one of the hardest things is getting in. Emotions and emotional demands, 100%. You're absolutely right. Seeing people's pain, exactly. One of the biggest things is that you're going into this profession, you're going into this vocational course wanting to become a doctor. And so you are an empathetic and you are an understanding person, and you're doing this out of goodwill in a sense. And so if you, obviously it's always going to take a toll. At the point where you no longer find it emotionally demanding, potentially you're burnt out. Definitely. Having the mentality, yes, yeah. Time consuming, social life balance, exactly. Time, retaining all the information, yep. Amount of content, yeah. So it's very different to your A levels or your IB, the style of teaching and learning in medicine. And possibly one of the hardest things I've had to kind of accept is that in medicine, everyone's clever and everyone's very good at what they do. And so you get stratified, you'll get broken down into cohorts and, oh, who's the highest of the year, who's the bottom of the year. And you essentially have to accept that you're never really going to be at the exact top, and you're always going to be pretty good, and you're never going to be able to learn everything. So it's not really like your A levels or your IB. You have to appreciate that you're never going to know everything. And once you accept that, and you accept your own flaws, then you become far more comfortable. Cool. So that's really good, guys. Well done. And what I'm going to do, the huge responsibility too, I've just seen that one. Yeah, exactly. It is a big responsibility. But what I would say is that as you progress through your medical degree, you gain responsibility. It's not just all plonked on you at once. So what do I think is the hardest part of studying medicine? So this is me kind of brainstorming, and I've got it here just to tell you a little bit about it. So I 100% agree with the workload. There's a heavy workload throughout. Different years are lighter. Your first year is generally the lightest workload, which is good news. And so it should be, because it's your first year of medicine. It gets a bit harder, and they slowly up the pressure to your final year when you're just about to register as a doctor. There's a huge amount of independent work, and there's collaboration, and you need to understand new study skills. And you need to understand new study skills and really appreciate how you learn, because there's different topics which you're going to learn in different ways. You can't learn drug names the same way as you learn the anatomical location of muscles. That doesn't really work. And so when I spoke about the two different types of medical course, I spoke about traditional and I spoke about integrated. So you could argue that there is a third, or there is an aspect of a third, and it's called PBL, problem-based learning. So you might have seen this when you're looking at some medical schools. You're going, oh, well, they do problem-based learning. I wonder what that is. So problem-based learning is a way of learning. It was actually created by Manchester University, I think in the early 90s or the early 80s, or I think Manchester University, Manchester Medical School kind of made it popular in medicine. What it is you work as a group and you're given a scenario. So patient X comes into the ward feeling like this, blah, 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 blah. And you have to set yourself a load of learning objectives as a team to understand, okay, well, I don't really understand what this patient's got leukemia. Well, what does that mean? What are the different types of leukemia? And how will this affect our family? So what resources are in the NHS to support patients with leukemia, etc. And then you meet at the end of the week and you discuss it with a supervisor. So that some universities have a bit of PBL. So Barts in the London, where I am, we had quite a heavy aspects of PBL in our first and second years. I personally really enjoyed it, because it's quite nice as a first year to be asked, oh, what do you think is wrong with this patient? Which is, you'd never be asked that because it's a made-up patient. You'd never usually get that kind of opportunity to chat about a clinical scenario in that context, when most of the time you'll just be being told to remember this drug name, etc. Some people don't really enjoy it because it's a lot of kind of teamwork and communication and a lot of sharing ideas. But ultimately, that's what medicine is. You're going to be working in a multidisciplinary team at the end of it. The NHS is made up of doctors, nurses, HCAs, physicians' assistants. You've got every other role under the sun. You've got rehabilitation specialists, physiotherapists, you've got dietitians, etc. And so if you are struggling to communicate with people, then PBL can really help with that. And it's a really nice way to kind of learn. But anyway, on a side note, work-life balance, again, they say that you can't have all three things in life, good work ethic, good social life, and sleep. So trying to balance all three of those is really hard in medicine, and you really have to set aside time. Cool. So how are exams structured, and is there a lot of group-related learning and presentation? So I'll come on to that now. So the work-life balance is kind of an obvious one, but exams is a less obvious one, perhaps, mainly because there's lots of different types of exams in medicine, depending on whether in your preclinical years or your clinical years. So in your preclinical years, you're going to have potentially essays. I had an essay last year on the diagnosis and treatment of chronic heart failure. There's an example. You will have multiple choice. A lot of med schools really like multiple choice questions, and they come from a big bank of questions, which is shared amongst all the medical schools in the UK. They're really popular. Don't think that because it's multiple choice, it's easy. They are potentially the most horrendous questions you've ever come across. Other exams are things called spotters. So they show you a picture of a cadaver. So that's a human who's been dissected. They might show you images of cells. So what we call histology, slices of tissue that have been stained, and they'll show you a cell and go, what cell is this? So that's a lot of your kind of preclinical exams. And you have to learn those in different ways. So you can't, as I said, you can't write an essay in the same way you're going to answer a spotter exam. And then as you progress through your years, you're going to end up having more clinical based exams. So we have something called OSCEs, OSCE, Objective Structured Clinical Examination. And what these are is these might be a clinician will ask you, do a respiratory exam on this patient, and you will have to demonstrate how you would do a respiratory exam. So it's using all the things you've learned in your preclinical years, and you're now going to kind of look for things and use different methods to test and see on a patient, okay, well, what might be wrong here? So you're going to be listening to the heart valves for a cardiac exam. You're going to be listening to the lobes of the lung in a respiratory exam. So those, again, are almost like role play. You have to remember a sequence of events. And that's a clinical exam, and you tend to do those towards the end of your career. You also have lots of other things. You have reflective practice. So you have to reflect on things you come across in practice that make you think, oh, I didn't like that, or I did like this. You may have to write critiques about papers. So there might be a paper saying, oh, this drug is better than this drug for this. And you go, well, okay, it might be, but let me actually really dig my teeth into this and understand, is that true? Because that's what we call evidence-based practice. You're not going to do something, you're not going to give a new drug if there's no evidence for it. So you're kind of engaging in research. And there's a million and one different exams in medicine. But don't worry about those now. Just know that there are different types of exams and they require different types of learning and different types of revision. So what is the best part of studying medicine? I would ask you this, but I'm just going to whiz through this right now. So the best part, in my opinion, is, for a start, I'm going to say research, because I'm currently taking a year out to do research. Working with academics and medics at the forefront of their field, constantly learning and eventually teaching. So someone said, I really enjoy constantly learning, and that's why I want to do medicine. And that's exactly true. You're constantly learning, and eventually you're teaching. You'll see foundation year doctors learning and then also teaching the medical students. And as you progress up the ladder, you never stop learning, but you learn a little less and you teach a little more. And working with academics at the forefront of their field. I mean, I'm at Barts in the London, and at Barts in the London, we have the Royal London Helicopter. We have a big trauma unit. And so I've worked with some of the top trauma surgeons, not worked with them, but I get to chat to them and I get to talk to them about their job, and I get to watch them and see what they do. And these are some of the top trauma surgeons. You go onto BBC News, you type in trauma surgeon, you'll see a picture of Professor Karen Brohy. He's one of the trauma surgeons there. It's amazing, the kind of people you meet in medicine. So working and being taught by these people and learning from them is so amazing, and it's really enjoyable. Does IB prepare you for med school? So I took A-levels, I didn't take IB, but I would say regardless of IB or A-levels or what have you, yes. Otherwise, they do prepare you for the content. You're not going to have to learn a huge amount more content than other people. Otherwise, they wouldn't accept it as an entry requirement in IB. It depends on how you learn, really. Everyone spends the first couple of months when you start med school kind of understanding, well, how do I learn? How's best to digest all this content? You can't remember everything. You have to be very selective. You go to a lecture on the brainstem, you're not going to remember all of the nuclei in the brainstem at once. You're just going to have to pick the most clinically relevant. So that's my answer to that. I will come on to extracurriculars. Secondly, I was just going to say the clinical experience as a medical student is such a privileged and unique position to be in as a medical student. It cannot be overstated. I would say you're in a kind of a really unique situation, the fact that you're not a doctor. So patients are sometimes willing to tell you more. They're sometimes willing to kind of let their hearts out. And sometimes just being there for someone to cry on is your role, and is priceless to that person. And it's really, really enjoyable to be able to learn about people opening up, telling you stories about their life. You suddenly get to see everything in a new perspective, and being able to empathize and understand and reflect on those experiences is what medical schools are looking for. And I'm going to talk a little bit about that in a bit. The ability to bring change in someone's life. Yeah, exactly. And then finally, extracurricular. So yes, medical students do have time for extracurricular. If you don't have time for extracurricular, you're either in your final year of study or you're working too hard. there's definitely extracurricular opportunities. I would say always try and pursue a sports club or some sort of interest other than medicine, because you'll definitely find in the medical interviews, they might ask you actually, well, what are you interested in? What other things are you interested in? How will you cope with stress, etc. I myself run for the university at the moment, so I'm quite into running. I cycle a lot. I kind of meet up with friends. I'm part of a few journal clubs. I get extra teaching in kind of major trauma. So there are some sciencey medicine-based hobbies, but there are some other ones. And you have an opportunity for something called intercalation. So not at Oxford or Cambridge, but certainly at other universities, typically a 5-year degree. They'll give you the option to leave the university for a year and spend 1 year in another academic institution, or you can stay at the university and do an internal intercalation, and you can study any kind of subject related to medicine. But you can do kind of legal studies at London School of Economics. I'm doing one called comparative pathology at the Royal Veterinary College. So for the person who likes disease, I do too. That's why I'm studying it in lots of different animals and looking at how they link with humans. The world's your oyster, and this is a really kind of unique part of the medical school curriculum, and something you could definitely talk about in an interview. Cool. So what's it like applying for medicine? I'm going to give, if anyone's got any quick questions about what I've just said, you can pop them in the chat. Otherwise, I'm just going to move on and talk about what it's like applying to medicine. Cool. So what's it like to apply? What's it like applying to medicine? So as someone said, possibly what's the hardest part of medical school is getting in. I would agree, but don't let that put you off. So the application timeline is really useful to come back to, and to get your head around and really understand, well, what have I got to do to get into medicine? So there's a paper application on UCAS. So that's the UK Universities and Colleges Application System, I believe is what it stands for. And essentially it's an online database. You'll get taught by your schools or colleges or what have you. And this is how you apply to university through it. You'll have to write a personal statement, and then the university looks at your personal statement, looks at some predicted grades that your teachers have predicted you'll get. And they go, okay, well, I like this candidate. Let's see if they did well in an extra exam, basically. And you have to do an aptitude test. And these you might have heard are either the UCAT or the UK CATs, it used to be called, and the BMAT. And depending on your grades on these, the university might go, oh, I really like this candidate. Let's bring them in for an interview. And so you'll go for an interview, and there's different styles of interviews. And then finally, you'll get an offer. This can look really scary at first. And when I realized the difficulty it was getting into medicine, it kind of threw me a little bit, but don't let it throw you. I'm going to talk you through a little bit. But before we get on to applying to medicine, etc., you definitely need to know that you want to study medicine. And at the end of the day, what they're looking for is they're looking for a well-rounded individual who is just both academically talented and academically smart, is hardworking, but also has those critical interpersonal skills, is empathetic, and actually really wants to help people. Because at the end of the day, you're going to be around people for the rest of your life, helping them. And so if you don't enjoy that, then you're not going to enjoy the job. And to make sure that you enjoy the job, things that universities are looking for is they're looking for you to have adequate work experience. So this is a really big thing that candidates get quite concerned about, is have I got enough work experience? And I would say more work experience is not always better. It can depend where you get it from, but you don't need to get it in a hospital, say. So myself, I spent 2 days in the GP clinic with a GP that I knew. They were really good. And then I spent a bit of time in a care home. I actually spent an hour every Tuesday for almost 2 years, which sounds a lot, but it's only an hour. And you go in once a week, and sometimes I missed it, etc. And that really helped. I spent a bit of time in hospital, literally a day. But some of the strongest candidates that I've heard of, and I've heard from lecturers who interview medics, are people who worked for a really long time in customer service roles and just interacting with the public. So people who worked in KFC and other fast food outlets, anywhere where you're interacting with the public is really good for an application. Because if you spin it right, if you learn from it and you show that you learn from it, at McDonald's or what have you, we had some very difficult customers, and understanding and working your way around that, and actually at the end of the day, the customer comes out happy, or you manage to deal with a difficult situation. Or I learned actually, maybe I am a bit judgmental sometimes of people, and actually I learned this, and that's really beneficial. And an interviewer really loves to see that. So it doesn't have to be, I secured a 1 week work experience with the top trauma surgeon in the world, because that's cool. But if you didn't really learn much from it, then it was pretty pointless for you to go and do it. And at the end of the day, this work experience is not something that you need to tick a box for, because this work experience is also for you. 99% of it is for you to really understand, actually, do I like the work that a doctor does? A GP spends a lot of time at their desk doing a lot of mundane things. But if you don't enjoy those mundane things, then you're not going to perhaps find medicine particularly interesting. If you don't enjoy understanding the social intricacies of, okay, this patient came in here and actually this patient's got a mental disorder and that's impacting the outer family, etc. If you really don't enjoy the people skills, then you're probably not going to enjoy medicine. But anyway, enough waffle with that. I'm just going to talk you through a bit of a crash course through the application dates, just to really help you here. So personal statement. So the personal statement is a 4,000 character personal statement. Some people say that universities don't read these. I think they do, at least mine did. And they asked me about it, which is a bit scary. So they're really important to get a really strong personal statement. And what is this? This is basically you. Who are you? Why do you want to study medicine? 4,000 words. You want to talk about your work experience in there, what you learned from your work experience. You want to show that you've got an active mindset, that you're really learning. When I talked about that reflective practice and understanding your flaws and seeing where you can improve and reflecting on interactions with patients, this is where it all comes in. If you worked at KFC and a customer yelled at you and you yelled back, and then you realized that that was really unprofessional to do and that you reevaluated it, write that, because that shows that you're far more kind of active in your learning than some other people. And so there may be some other forms and applications that also have to go in here. So for your UCAS, you'll get your predicted grades from your teachers. These make a really strong and helpful aspect of your application. There may be other forms applications. I applied to Manchester and I got in, but I didn't accept the offer. But they required an extra form saying why Manchester. So because you're applying to 4 universities or 5 universities with the same personal statement, sometimes the university will reach out to you and say, well, why specifically us? Can you write us a couple of words about that? And so sometimes they might require that. And so this is all due by the 15th of October. Ignore that date there. That date is out of date. 15th of October, or essentially October. So that's the submission deadline for Oxbridge. So Oxford and Cambridge, any course at Oxford and Cambridge, medicine, dentistry, and I think veterinary. And then there's also aptitude tests. So aptitude tests are actually due, you have to kind of finish them maybe before or after your personal statement. It's useful to do them before the personal statement, and then you know your grade, so then you know who you're applying to. Because some universities will say, well, we take a UCAT score of something 1,000 and above. Sometimes they take that into consideration, so they contextualize it. So they go, well, this candidate didn't have a great UCAT score, but they actually had a really good personal statement. and they're a straight A style student, so we'll give them an interview. So don't be put off by these kind of these thresholds that you might look up. But what these aptitude tests really are is they're a study of can you learn kind of a load of information, and how committed are you to medicine? Certainly I took the UCAT, and the UCAT is quite a formulaic test. You have to kind of learn a load of ways of thinking, and you learn how to answer it quite formulaically, and you get very good at it. These are kind of IQ tests, but if you spent a couple of years learning them, as if no one would ever do that, but if you did spend a couple of years learning it, you could probably get some of the highest scores ever. So that you could argue that's not an IQ test. It's just something that you need to learn. And similarly, 6Med offers some courses on UCAT and BMAT, and they're fantastic. But they're a story for another day. I wouldn't get too worried about these aptitude tests. Is it better to do UCAT and BMAT, or both of them? Okay, so this is another thing to remember. When you're looking up your dream university or whatever university you're interested in, these universities are going to tell you, well, we require your BMAT, or we require you to take the UCAT. So Oxford and Cambridge require you to take the BMAT, the biomedical admissions test, and they look at those scores. There's a few other universities that look at that. My university, Barts in London, they required the UCAT. The way I did it is I streamlined my admissions. So I applied to all universities that required the UCAT. And that's because I came out the UCAT and I was like, oh my gosh, I never want to do that again. And I suppose I could have done the BMAT, but I was happy with Barts in London. They're one of the only London unis where you can get in just doing the UK CAT. The BMAT, you could just do the BMAT and then just apply for Oxford or Cambridge and then a load of London unis, or you could do both. And most of the people I know have done both. So to answer your question, it depends on the university you're applying to. They will tell you what grades they want you to have predicted wise. They'll tell you what exam they want you to do. And they will tell you potentially what scores they're looking for really to offer you an interview. And the UK CAT and the BMAT, slightly different, or the UCAT and the BMAT, sorry, slightly different. The UCAT is an online test. The BMAT, I'm not 100% sure whether it's fully online anymore. If it is fully online now, I wouldn't be surprised if it is, but there's an essay essentially at the end. And this essay can crop up in your panel interviews if you do have one at a later date. So that essay gets sent to the universities. And so the universities might be like, oh, so in your BMAT, you spoke about how radiologists are really important in this role. Could you expand? So just a little heads up there. Once you've done these aptitude tests, and you typically get your scores back pretty quickly after them, you might be offered an interview. I'm sure you'll be offered an interview. And these interviews typically happen December to February. They happen a little earlier, they might happen a little later. And they come in two formats: panel interview, MMI. Panel interview is your stock panel interview. It's the kind of one where you turn up and you sit on a table and there's 2 or 3 people opposite you and they ask you questions. There's 101 different questions they can ask you, and they all have little intricacies at different universities. At Barts in London, they gave you a bit of pre-reading to read a news article 2 weeks before, and then they asked you questions about it. Some other places for the panel interview, they might place you in front of another medical student who might question you about how much do you really know about medicine and applying to it. So there's loads of different types. And the other one is something called MMI. You might have heard of this. It's a multiple mini interview. Think speed dating, but interview style. So the classic one is there's 8 stations, each with an interviewer on each station. And you sit on station for 5 minutes and then you move to the next station. And each station asks you something different, or they ask you to role play a scenario, or they ask you to describe how to tie your shoelaces without actually doing it yourself. Lots of different skills, and they're all related to medicine in some ways. There might be a bit about what's the GMC, what do they look for in doctors, or here's some parts of the body, have a guess where they might go. Or there's a lot of kind of mundane ones. So there's a lady here crying, ask her what's wrong, console her. It doesn't necessarily have to be obviously related to medicine. It can just be something. I've had one where a bus crashes into a cafe and you have to choose your next actions. And it's all about prioritization, which is a skill of a medical student. And that's actually Nottingham who asked that. So there's 101 different ones. Both of these, there are courses by 6med you can take, and different companies, they can help you with this. So again, don't stress with this now. And then the final thing is offers. Offers are obtained via UCAS track. So there's this kind of horrible but also lovely period after you've done your interviews where you are every day checking UCAS track. And then you get a little email and it says, UCAS track has just been updated. And you go, and then you have a look and you get an offer and you're like, wow, I'm over the moon. And that offer typically is, we require you to reach these grades. You don't get unconditionals in medicine. The only time you'd get an unconditional is when you've already achieved your grades and you perhaps didn't apply for medicine immediately, but you've already got the grades, and then you apply and they say, okay, you're in, because we know you've got this grade. Cool. So but what I would say is the most important at this stage is work experience. I think work experience honestly is gold dust. And if there's something we can learn from the vets, so veterinary medicine, so these are animals. In veterinary medicine, they require you to have a certain amount of hours of work experience, basically, with different animals. And to an extent, that should kind of be the case in medicine. In a way, you can learn so much from work experience. But it doesn't have to be with the top trauma surgeon in the world. It doesn't have to be in a hospital, quite frankly, or a GP practice. It can be in a charity shop working with people. Essentially, you want to be working with people and learning from your experiences and making mistakes and reflecting on these and becoming a better person because of it. And if you can show that to your medical school, they're going to love that. And that's a really strong thing that a candidate can show in their application. Cool. So I think I've kind of come to the end here. It's a bit of a whistle-stop tour. I know it's 8 minutes too, and I feel like I've rambled on a little bit. I hope that was helpful for everyone. What I've got here is, I think we've got you can ask me anything on this Mentimeter, essentially. You can, it's completely anonymous, so you can just throw anything you want to know up there. I'm going to try my best to answer this. And I hope you found that helpful. I know that was very much a whistle-stop tour through some of these kind of aspects of medicine. Is clearing always available? Depends on the university, depends on people achieving certain grades. Certainly some universities will have more clearing than others. It very much depends. You're not really going to see clearing in Oxford and Cambridge, I'll give you that. You might see clearing in some other types of universities. But yeah, clearing is sometimes available. You could be a bit more confident in yourself. Don't guess that you're just going to get in via clearing. You can definitely get in with the grades. What would you say is the most beneficial way to spend your gap year once you've achieved the A-level grades? That is a very good question. I would say after you've done your A-levels, work, get some money, and then go and enjoy your life a little bit. Enjoy being free. Enjoy having that bit of time off. A lot of people I've spoken to in medicine who I certainly myself went straight from sixth form to university. A lot of them say, I wish I had a little break and I spent some time exploring the UK or the world or what have you. It's a bit of a cliche, but it's true. What I would say is there's loads of jobs. Certainly, I spent a little bit of time in my summer holidays working as an HCA, so a healthcare assistant in a hospital. It doesn't have to be in a big hospital. It could be in a GP setting or what have you. But an HCA, a healthcare assistant, is a role in the NHS where You don't necessarily have to have masters in medical training. You tend to be doing a lot of tasks such as changing clothes, you'd be changing beds, you'd be serving meals, etc. It's a lot of the real kind of groundwork, a lot of the legwork that the NHS runs on, basically, and it is one of the most valuable jobs. And HCA is a really good job, but anywhere, being a care assistant in a care home, just any job where you can get a little bit of money that can help fund you. You have interaction with patients, etc., and you can kind of enjoy the job a little bit. And at HCA, what's really nice is if you are doing kind of these more legworky courses, these kind of jobs that the NHS really runs on, like HCAs are some of the most invaluable people and some of the nicest people in the NHS. Suddenly you realize as a doctor, when you're on a ward round or something as a medical student, certainly, and the patient, you can see that the patient's cold. You're not going to then go and ask the HCA, oh, can you get a blanket? You're going to go and get it yourself because you know how hard those HCA workers work. And you know what it's like being an HCA, and you can really appreciate it and understand, actually, we're all part of a team here. How do you apply to become a healthcare assistant? And do you need any extra requirements? No, you just need GCSEs or anything the equivalent. I did it because my local hospital were looking through it during COVID, but there usually are kind of healthcare assistant roles available. And I know a lot of healthcare assistants who eventually become medics or eventually become nurses, which is quite cool. One really cool job you can get is as a phlebotomist. You don't have to have that. I think you have to have a few GCSEs, few A levels, and you can practice cannulization and things like that. So you get to do some of the blood works, but not as a medical student. That's really cool. But these are kind of in an ideal world. Working in Tesco's and interacting with people and learning from that, quite frankly, is fantastic too. Just showing, if you're able to show that you've learned from working in a customer service role, or working with patients, and you actively engage in medicine. I've listened to a few lectures, open lectures from the Open University on medicine. I find this really interesting, and I spent some time, at Tesco's, and this happened, and I did this, and I felt that I wasn't very good at it, so I did this little free online course online, and I learned this. That's all the kind of stuff that unis go, wow, this person has a real hopeful future as a medic. Cool. So what made you choose medicine? What made me choose medicine? That's a very good question. I think I chose medicine because I really enjoyed working in a care home. I knew I was sciencey and that I was quite good at, my A-level grades were good. So, okay, you're good at, I did biology, chemistry, physics at A-level. I didn't do maths, I was a bit daft, but I did all those. I did well in them and I was academically strong. But you could do any course really, any STEM course like that. But what I had is I was fairly good communicationally and I enjoyed working in hospitals. I enjoyed seeing, I remember being in a GP practice and going wow, this is so cool. You're seeing all these patients and you seem to know them really well and you can actually help them. You can actually, and sometimes the most important thing is when you can't help someone, how to accept that. Sometimes medicine, you can't do anything. You just have to look on in kind of horror. And when you really appreciate that and you really kind of connect with that, I suppose that kind of draws you into medicine to really help people. And you combine your kind of love of people and helping people and understanding that with kind of the medical side and academia. There's a million and one different answers to that. What would you suggest to students who are redoing year 12 or are thinking about it? So with year 12, do you mean year 12 or year 13? So year 12, so that's your first year of sixth form. If you're redoing A-levels and you did a humanities route and now you're thinking about going back and doing more sciencey routes, that's amazing. And kudos to you. That's really cool. And I think some of the best medics are people who Some of the best medics I've met anyway are people who did humanities courses at A level, or did a previous degree in art of history, because they're so well-rounded, and they're just less kind of, they're really strong sciencey. They're very good at science. They're very good at kind of academia, but they're also very good at kind of, they're more well-rounded, really. I don't know. I don't think I can give you any like exact advice on that. Just know that you are not at a disadvantage, provided you haven't already taken the A levels and got A level chemistry and got a C and then redoing that. Provided that's not the case, then you have nothing to lose. And if anything, you become actually quite an appealing candidate. Pre-reading. Okay, yes. So it's kind of quite technical. There's loads of things you can read up. Certainly the medic portal on the internet is really good website for like preparing for interviews, but any interview course is also very good. Pre-reading. NHS principles. I mean, I learned all the NHS, like the NHS charter, and it never came up once. If I was to recommend a single thing to know, it's GMC Good Medical Practice. You don't need to remember it, but gosh, go and have a read of it, because it tells you everything. So the GMC is the General Medical Council. You might have heard of the BMA, the British Medical Association, and the GMC, the General Medical Council. The BMA has this little logo here. Looks like a little snake. And they represent doctors. And they are very similar to kind of a union. They are basically a union who represent doctors and doctors' interests. Then you have the GMC, the General Medical Council, and they are the governing body of doctors, because they choose what doctors can and can't do, but they kind of represent patients and the interests of patients. Because at the end of the day, if patients want doctors not to be able to do something or do something, then that's what a doctor should or shouldn't do. And so the BMA and the GMC kind of discuss, and sometimes they clash about certain issues, but the GMC Good Medical Practice is what patients want doctors to be, and they outline all of what it means for good medical practice. What does the ideal doctor do? So we spoke at the start about House MD. House MD is the opposite of GMC Good Medical Practice. You look at House, you look at all the qualities he's got, then find the opposites, and that's what's on GMC Good Medical Practice. So that's probably the best thing you can read. But honestly, any book too, any book which you've learned from, quite frankly, is really important. But yeah, if I was to say anything, GMC Good Medical Practice. How much does GCSE grades distribute into getting an offer? Okay, so it depends. Most of it, I would say, comes down to your predicted A-level grades. I would say, so you will have heard people who get into medicine, they had good A levels and they have good GCSEs. And I think it's because if you typically get very good GCSEs, then a lot of people will end up getting quite good A levels. But you can have fairly poor GCSEs, but if you do really well in the A levels and you get your grades, then you can get in. It certainly doesn't really matter too much. What depends the most is your predicted grades. So if you are you didn't do particularly well in your GCSEs and you didn't have particularly good predicted grades, you're going to struggle to get an interview. But if you didn't do particularly well in your GCSEs, but you have really good predicted grades, then you're more likely to get an interview. So again, it's very easy to get sucked in and looking on the websites and trawling through, oh, well, what exactly do they require? What do they need? But I literally lived with a medic last year who got in with ABB into a university that required A-star AA. I'm not sure what he did. Maybe he had an amazing interview. Maybe he had amazing UCAT. I'm not 100% too sure, but I would say when you're reading these universities and what they want, take everything with a little pinch of salt, because if you do really well in one component, you might find that you're a bit better in another. You might be looked at more favorably. So GCSE grades are important because they'll end up looking at that, but it's not the first thing they look at. The first thing they look at is your predicted grades when they're looking at the grades that you're getting. Due to limited unis that use BMATs, is it reasonable only to do BMATs? Yeah, well, I did only UCAT, so you could do only BMAT. The reason why I only did UCAT was because when I came out the UCAT, I was like, I'm too tired. I'm a bit burnt out from this. And if I was to hard revise BMAT, I don't think I was going to get a particularly good grade straight after. I really crammed my UCAT and I really, revised pretty solidly for it, and did fairly well. I was pretty chuffed. So yeah, you could do it vice versa. You just have to, it's a bit like poker. You put all your chips in with this. Like, you are putting all your eggs into one basket by providing you get a good BMAT. But if you revise really well for your BMAT, then you're fine. You just have to have a good BMAT. Yeah. How's accommodation for you? Is it better living with the medics? So my first year halls, I lived with medics and dentists. Second year, I lived in private accommodation with just medics, which works occasionally. It works because you all kind of collaborate. I would say the best is when you live with medics in different years, because you're not coming home while you're cooking your pasta, discussing the same lecture on the inner ear. Because it can get really tiring. You want a bit of space. At the moment, I'm living on the Royal Veterinary campus because I'm doing research here, and I live with a load of vets, and I really like that because they just chat about veterinary, etc., and I have something different to talk about, and it's really nice. And it's, I would say, it's who you are as a person. Would you like to live with other medics and talk about medicine? It can be a little bit intense, but at the same time, it can be enjoyable. And it depends on the university you're at. If you're at Barts, then in your first year, you live in halls with medics and dentists. So you are going to live with a lot of medics. If you go to Southampton, per se, and you go to Southampton Medical School, you will live with a mix of students. You might mix with some fine arts students. You might mix with some English students. You might mix with some chemistry students, etc. Do you need to be good at maths to study medicine? You need to be good enough at maths to get good predicted grades in your subjects. I am not particularly great at maths. I didn't even take maths A level. I still got in. No, it's not particularly mathsy. There's a little bit of kind of mental maths occasionally. But at the end of the day, I use a lot of calculators a lot of the time. So you don't have to be amazing at maths. No. A lot of people get worried about, do you have to be really good at chemistry, like a chemistry student? Because people get confused. They're like, well, why do they require chemistry? Is it really chemistry? It's not. The general consensus that medical schools require you to have a knowledge of chemistry, because chemistry is quite a hard IB or A level. And so if you can prove that you can get a good grade in that, it shows that you're a really hardworking student, and you're a good person to be in a medical school. And also chemistry gives you a little bit of background. The most I use for chemistry is a lot of acid base, kind of more kind of technical stuff. Is there anything you did that was above and beyond that helped you stand out? I think having 2 years doing in a care home was pretty good. Like, that sounds good. But it was once a week, and it was like a couple of hours, now a couple of hours. But if you can say, oh, I did 2 years in a care home, people go, oh my gosh, you did 2 years in a care home. That's quite a lot. There was a club at school where we had some teachers who are really interested in public health. And I lived in area of England called Dorset. And in Dorset, it's quite rural, and lots of people have dogs. And lots of people have dogs in the summer months, and lots of these dogs get ticks, these little kind of parasites that live on dogs. What we were interested in is that from ticks, you can get something called Lyme disease, which is spread by a little worm, a little spirochete called Borrelia burgdorferi. And I don't know why, but the teachers were really interested in this. And we had something called Tick Club, which was fairly daftly named. But we used to grind up ticks, and then we did like PCR on them. And then we did gel electrophoresis, and we had a little look. Sounds really technical, but it was just to show I'm interested in science and I'm interested in medicine, because I did a little bit of kind of very basic research. I was basically looking to see, do these ticks have Lyme disease? What percentage of ticks in my area have Lyme disease? And we found like 1 or 2 with Lyme disease. So that was kind of interesting. So that, I think, helped me. But honestly, I think any opportunity you get to kind of benefit yourself, take, because it's going to help you. You don't need to regularly go on a Monday afternoon to a tick club to get into medical school. No. Cool. So I think I've answered that. Has anyone got any more questions? I appreciate I kind of rambled through that presentation really quickly. It can be about anything. Anything about medicine, anything about if you're doing A-levels, literally anything. But I hope that was really helpful for everyone. This is kind of, I should have really named it the honest opinion of a medical student. But what I would say to everyone that is currently doing their A-levels or their IB, enjoy it. Really enjoy your A-levels. Yes, my A-levels, the equivalent IB were something like my favorite time at school. I learned so much. So really try and enjoy it as much as possible. Would you recommend your university? Barts in the London? Yes, it's quite small. That's the only thing. It's quite a small, tight-knit university. There's not tons of students there. And what we do is the medical school is kind of separate from the rest of the university. So I'm technically part of Barts in the London School of Medicine and Dentistry. Sorry, not Barts in the, I'm technically part of Queen Mary University of London, but we call ourselves Barts in the London School of Medicine and Dentistry because we're on a separate campus, the medical school. And we interact with the vets, not the vets, the doctors, the dentists, there we are, right profession, the dentists and some like allied health, so like global health, pharmacists, etc. It's a really fun uni. And something you should consider when you're applying to university, though, is where in the UK you want to live and what kind of placements that will give you. So, as I said, I grew up in Dorset, so it's quite rural. So I enjoy living in the city. I love London. I love East London. I love the kind of unique, multifaceted, multicultural diversity there. And the placements are in London too. Sometimes if you're in a really busy teaching hospital, you might not get the best teaching, but you're going to see some amazing things. And if you travel a little bit further out, so occasionally I have placements in like Southend or Colchester, you get amazing teaching there. But if, say, you want to live somewhere a bit quieter and you want to be by the sea and you might want more kind of less intense London hospital placements, maybe go to Exeter or something. There you are. Do you think 3 months of hardcore revision is enough to get an A star? If you're talking about A-level or IB, I would say work smart, not hard. That sounds really cheesy. But work smart. A-levels and IB are quite formulaic exams. I would say use practice questions. The more practice questions you use, I remember reaching a point in my A-levels where I did like so many practice questions, I got so bored. You could start to predict what questions would come up sometimes. And you could be like, oh, I see. And you would be like, oh yeah, I remember this question came up a couple of years ago on this little old one I came up again, this old paper I saw. So try and revise through that. If you're doing biology or chemistry, they're not going to ask you about something really niche sometimes in the syllabus. Typically, they'll ask you very standard questions that always come up. And so if you're ready for those, you can answer 50% of the questions already. Before you even look at the paper, you already know which questions are basically going to come up. And then from then you so just work smart, figure out what they're going to ask. I hope that kind of answers your question. I believe in you. I'm sure you'll do well. You turned up to this webinar, so you're clearly hardworking. Any other questions? Cool. So I think we'll call it there. At the end, I had my email address somewhere. Cool. If you've got any questions, any kind of burning questions, or you're like, Joe, you showed this PowerPoint slide and it was a load of rubbish and I don't really understand. Or if you're interested, Joe, what is parts really like? You're more than welcome to email me. This is I'm currently answering emails at my RVC address most commonly right now. So if you've got any questions regards, or you can speak directly to the 6med team and they can pass on messages. But I really hope that was beneficial for all you guys. Best of luck with everything. I believe in you. You'll get there. I think the best message I got told was by my physics teacher. They said it's not a question of if you get into medicine, it's a question of when you get into medicine. If you keep going, you'll always get in. It's just how long and how hard you're willing to get in. But yeah, good luck.